Hi, Mr. Rudick. I'm your hygienist today, and my name is Megan. How are you doing today?
I'm doing pretty good. Been dying to get my teeth clean and feel nice and smooth again. I hope this appointment doesn't take too long, though, because I'm going golfing with my wife and family this afternoon. It's my favorite way to get out and get active.
Well, I'm glad you're getting out there and you're doing something active. And I'm also glad that I'll be able to help you out today. And don't worry, I will make this appointment go as smooth and fast as possible while also doing a thorough job. Anyways, let's get started on your medical history after I take your blood pressure.
It might be a little high since I'm under the care of a physician due to blood pressure monitoring and smoking cessation. I haven't had a cigarette in 5 days now.
Oh, wow. Well, congrats. Also, your blood pressure looks like it's okay, which is, it's a little high. So it's 139 over 89. But if you're seeing a physician for this issue, that's all that really matters. Do you have any current systemic diseases or allergies that you want me to be aware of, or any recent hospitalizations?
Other than my hypertension issues, I'm taking Zyban and Nicorette to help with the smoking cessation, but that's it.
Okay, well, awesome. So I see you're missing a couple teeth on your radiographs, and you haven't been to the dentist in 12 months. Do you have any other dental history that you want me to know about?
I lost those teeth years ago, but that doesn't really bother me, to be honest. Actually, I now have to brush less teeth because of it. I do want to add in the reason that I came today is because my wife said my teeth look like they're getting loose. I didn't think it was a big deal, but she seemed pretty worried about it.
Well, I just have a couple more questions then. How important is it for you to keep your teeth?
It's somewhat important.
Okay, well, how important is it for you to treat or prevent gum problems in your mouth?
Important if it means my mouth will stop bleeding and tasting all nasty.
Okay, so today we'll figure out why your teeth are getting loose so we can try and prevent you from losing any more. And hopefully we can get rid of that bleeding and bad taste as well.
That sounds good to me.
Awesome. Now I'm going to do an oral assessment so we can see how your mouth is doing health-wise. I'll be looking at your tissues, feeling your teeth for any tartar or plaque buildup with my instruments, and probing your gums. Have you had your gums probed before?
I have not.
Well, basically I'm just going to be taking this little ruler that's measured in millimeters, and I'm going to walk it around your tooth to measure the depth of the space between your tooth and the gums. And it shouldn't hurt, so you should let me know if anything's uncomfortable for you. And we want measurements of 2 to 3s. Those are the best ones that you're doing great. But when we start to see higher measurements is when we start to begin to worry that there's something else going on. And we will get to the bottom of what it is.
Okay. Well, let's do the assessment.
All right. So, now that your assessment's done, it looks like you have what we call chronic severe periodontitis. And you'll definitely have to have a good cleaning done. You have some pockets that are pretty deep in the back of your mouth, in those bigger molars. And they're about ranging from 5 to 9 millimeters, which is not good. Do you know what gum disease is and what causes it?
I've heard of it, but I don't really know what it is.
Okay, well, gum disease starts when you get bacteria in those pockets that we measured. And your teeth and gums start to get an infection from that bacteria.
Ugh.
And basically, it comes from plaque and tartar buildup that you have on your teeth. And when you have an infection in your gums, that means you also have inflammation that occurs from your body's response to the infection of the bacteria. And the inflammation causes destruction and deterioration of your tissues in your mouth, eventually leading to tooth loss, which is why it's important for you to come to an office and get your teeth and gums cleaned by professionals. Dental professionals are the only ones who can thoroughly debride your teeth and your gums of bacteria that is causing your disease. And I just want to show you a couple of things.
Oh, wow.
Yeah, I like to use this to show patients like you what we're actually looking at, the bigger picture. So this is healthy. This is what we want. Everything's nice and intact. You see all these fibers are connected to that tooth root still. The bone's looking really healthy, and that probe reading's about 3.
Okay.
And this is gingivitis. So you can see your gums are starting to get a little, bothered.
Yeah, they look a little kind of red.
Yeah, so it's about 4 millimeter, 5 sometimes, but this is reversible, and it doesn't affect any of your actual fibers or bone levels.
Okay.
And then we start to get to early periodontitis, where we start to see that tartar and calculus buildup on the tooth that is causing that bacteria infection and making that pocket get a little deeper. And you can see that this is about like a 6 millimeter, 7 millimeter reading, and that bone is starting to go down and those fibers are starting to go away.
Mm-hmm.
This is moderate, which is just keeps on getting deeper, keeps on getting more of that bacteria that needs to be cleaned off. And that bone just keeps going down, and so do those fibers as well. And this is, like I said, irreversible. So this bone cannot be.
It's not coming back?
Nope,
Shoot.
cannot be regenerated. And then finally we have advanced periodontitis, which is very deep probe readings, about 9, it looks like here, very deep, with tons of bacteria and buildup on that tooth, and that bone level is very low. This is dangerous. This
bad.
is not what we want to see. And this is where some of your teeth are, especially
Really?
those ones in the back.
Seriously?
Yep. Some of them you have some very deep pockets in, so
Oh no, that's not good.
we'll be talking about what we're going to do with that.
Okay, so how do I get the bacteria out to reduce that inflammation and the infection that's causing? Can I get my pockets to heal up and get shorter or smaller again?
Well, I would start by coming in and getting those cleanings done diligently and having meticulous home care. Your pockets will probably never be back to where you'd want them to be, but with good care, you can halt your progress and possibly reduce the pocket depth by a little bit.
That sounds good. I mean, I'll try my best, but money is kind of tight right now.
That's totally understandable. Dental work can get really expensive. But the biggest issue here is that we are really looking for you to come to a dental office every 3 months to stabilize your disease. And you're only coming in about once a year.
Well, like I said before, it's hard. Money's tough to come by right now.
Well, here at MSU, we offer lower prices compared to other offices. So I think that we will definitely be able to help you out price-wise. But I want you to know that the condition you have will be something that you need to take control of for the rest of your life if you don't want to pay to completely get brand new teeth and have all of them removed and get partial dentures someday. Because that's where you're headed if you're not going to make the move.
Oh, yeah, I get it, man. That sounds bad. I got to start taking control of my oral health and to prioritizing more. I don't want dentures.
Well, I'm glad you realized that. You're doing a great job of understanding all this complex information and actually wanted to change for the better.
Thank you.
Before I dive into telling you about the services that we will need to provide you with for your condition, I just want to talk a little bit about the things that you need to do on your own as well to make this all worth it in the end.
So what do I need to do?
I would like you to continue to not smoke because smoking is one of the biggest factors in gum disease, and it's probably part of the reason why you have the severe gum disease that you have now. It would also be ideal for you to have better oral hygiene by brushing 2 times a day with your electric toothbrush with that slide and glide technique. So no harsh brushing, just let your toothbrush do the work and just go around on those teeth.
Okay.
I would also like you to floss every day with your reach flosser and interdental brushes in those bigger spaces you have. Using an anti-cavity toothpaste with high fluoride would also be good as well. It's also helpful to use an end-top brush in those spots where you're missing teeth to get all the surfaces of those surrounding teeth. And it'd be good to use an antimicrobial mouth rinse such as Listerine to help fight off some of that bacteria causing your infection. Finally, you should continue to see a physician regularly regarding your prehypertension. And you should get your cavities filled so decay does not continue, because you don't want to lose that teeth that way either. I will give you a handout with all of these suggestions and instructions to take home as well, because I know it can be hard to take all this in as I'm saying it to you now.
Yeah, that would be great if I could get a handout. I mean, I'm willing to give this a shot.
Awesome. So the procedures we'll be doing in your mouth is scaling and rip planing, which is a deep clean below the gum line on the bacteria and tartar that's not easily seen or visible and removed by a toothbrush. It's what we do to treat gum disease and make your pockets free of that harmful bacteria causing your infection.
Yeah, That sounds sort of familiar. I feel like I've had something like that done in the past.
You probably have, considering your condition. At MSU, you're going to be having 5 appointments, including your tissue check after you're done with the periodontal therapy. Your first appointment is today, and we're doing the assessment, x-rays, dental exam, smoking, cessation, and some perio and caries presentation, and we already went over your medical history and cleaning habits I want you to uptake. And we're going to be doing local anesthetic to make you as comfortable as possible while I'm doing the cleaning.
Good.
And which the cleaning will include periotherapy. And so by the end of this appointment, it'll be about 4 hours. And we'll get that first quad in the lower right side of your mouth done. Because when we do a local anesthetic for your pain management, we only want to numb part of your face for the part that's of interest.
Mm-hmm.
And basically by the end, it'll be $75 for scaling and replaning in that one quad. But then it's also going to be another $30 for the dental visit today and $30 for the updated bite wing images we took. Your second appointment will be the same as the first, other than the fact that we'll be doing quad number 1. And we'll be doing local anesthetics in a different area this time. We're going to be doing it at the upper right side and getting this whole part of your mouth done. And it'll numb your oral and facial and teeth up super well so you won't feel a thing.
Good.
I'll also be placing a Restin in some of those teeth to help fight off that bacteria. It's basically just a powder that we put in there. I'll explain more afterwards.
Okay.
It's completely free, which is awesome, considering people pay $50 or more at other offices to get a Restin.
Wow.
And yeah, so much of them. Your next appointment is going to be your third appointment, and in this one it'll be about 3 hours long as well, and we're going to be doing another quad. So the lower left, which is quad 3, and this is also going to be $75. And did I talk about your second appointment already?
Talked about my second. I think you were talking about my third appointment.
Okay. So in the first and the second and third appointments, I'll be doing those quad. Well, yeah, we did talk about the second, didn't we? Up here.
Yeah.
So the third quad is going to be 3 hours long as well. We're going to do mostly everything the same. There's not going to be any rest in place in this one. It's going to be $75, and it's going to be in your lower left, which is quad 3. And then your fourth appointment is going to be 3 hours as well. Going to do everything the same, and you're going to be in the upper left is quad 2, and you're going to be placing a Restin and some pockets up there too. All the pockets that we're going to be placing a Restin in are on teeth 2, 3, 4, and 5, which are in this part of your mouth up here. And then we're going to be placing it on 14, 12, 13, and 16, which is over on this side. So it's mostly your top teeth that we're worried about with those deep pockets. And then after we finish all that periodontal therapy, you'll want to return in 6 weeks for a tissue check. And this will be your 5th appointment. And then at every 3 months after that, you're going to want to do periodontal maintenance to hopefully stabilize your condition. The ultimate goal here is to get those pockets to a level we can maintain long term, and these appointments will be $55 each time.
Well, it's a lot cheaper than most of the dental offices I've been to. I'm glad we're getting this all figured out, but I know you said earlier you'd explain it, but I'm still kind of foggy on what a Restin is.
Okay, so a Restin is an antibiotic that is in powdered form, and we put it in those deeper pockets to basically get rid of that bacteria and help heal that pocket up. And it'll actually get kind of sticky and stay in that pocket and slowly release. So we want you to stay away from those areas for the first 7 days when you're brushing. And we're going to administer it with a little syringe by sliding into your gum pockets, and then we fill it up with powder just know that when the powder gets wet, it will be sticky and actually harden.
Okay, that sounds pretty easy. I'd love to have it done if it'll help out my pockets and my disease.
I believe it definitely will help. So let's go ahead and start with your cleaning, and then we'll put that Restin in those deeper pockets you have. I also want to let you know that if you have any reactions to the Restin, such as allergies or any kind of lesions that start to show up in your mouth, just call us and we will get that looked at right away. Just know that this isn't a common side effect, and I'm not expecting any major problems.
That sounds good.
All right, so now we just got done with our first quad of scaling and rip planing, and You've been a super great patient. I just want to let you know that.
Thank you. I
And
appreciate it.
the SRP went super well, and that arrestin is placed now in that pocket.
Nice.
And it's going to be working and bringing that infection and bacteria down. Now I just need you to not touch that area for a week. I also want you to avoid hard, crunchy, and sticky foods such as carrots, taffy, or gum for that amount of time as well.
I normally chew a lot of gum, but I think I could manage that. I'll just make note of this so I'll remember.
Sounds good. I'll be sending you home with a handout for that as well, just so you remember. I also want you to stay away from flossing those back teeth for 10 days. Do call if you have any reactions, like I said before. A little bit of sensitivity is normal, and yeah, just let us know.
Good, okay. I mean, I don't floss my teeth much as is, but after those 10 days, can I floss my teeth again? I mean, I try to floss 3 times a week. I know it's not as much as you guys tell me to, but can I floss my teeth after those 10 days?
Yes, you can floss your teeth after those 10 days are passed. At your tissue check appointment, after your second SRP appointment, or your last SRP appointment, we will be reevaluating your pockets and the places that we placed arrest in to see how your body reacted to it.
All right, let's get that last cleaning appointment and follow-up appointment set up now so I can put it in my planner.
Okay, so you're all set up now, and I'll be seeing you in 2 weeks for your last couple SRP appointments, and about 1 month after that for your follow-up. And here is your handout.
Thank you so much for your help. I really do hope this works for me. You seem like you really know what you're talking about.
Thanks. What?
I just want to say I hope you have a good rest of your day.
Yeah, thanks for coming in and choosing MSU for your oral care. See you soon.
See you soon.
Good morning, Mr. Dick. I'm going to be your hygienist today, and my name is Megan.
Can I not smile?